Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with earwax in both ears. Now this is their right ear, and that right ear they have what we call an acoustic neuroma, also known as a vestibular schwannoma, and I'll come back to that in a moment. Now this is the patient's left ear. This is the ear that they're able to hear with, so this is so critical for the patient that it's never blocked. And they do wear a hearing aid in this ear as well, so it's not, they don't have completely normal hearing in the left ear, but it's far, far better than the hearing in the right ear. And you can see there's this wax has been, they've used hydrogen peroxide drops, which has almost bleached the wax, so hence the discoloration and the consistency, and it's really up against the eardrum, so just using a fine end suction probe, just gently suctioning that away, and you can see the eardrum there, and that made a big, big difference. Now, in their right ear, as I mentioned, they have a condition called vestibular schwannoma, which is sometimes also called an acoustic neuroma. So what's an acoustic neuroma? It's a benign, non-malignant soft tissue growth that develops on the balance nerve. Now, the audiovestibular nerve, so that's the eighth cranial nerve. It's formed by both the auditory nerve and the vestibular nerve, which is the nerve for balance, and it kind of intertwines. And I'm not sure the exact prevalence, but I think it's 1 in 1,000, if memory serves me correct. They can develop to soft tissue growth on this, the balance portion of the audiovestibular eighth cranial nerve. And if so, that soft tissue growth can expand and grow and then compress against the auditory nerve, and it can cause hearing loss in that ear, typically at the higher frequencies, but it is also known to affect the mid and low frequency sound transmission as well. And it typically also causes other symptoms such as vertigo, so a sensation of the room spinning around or you spinning around the room. Typically with an acoustic neuroma or vestibular schwannoma, that occurs with sudden head movements. It can also cause veering off to one side when you're walking. Now, I'll just come back to that in a moment. You can see we've released that skin plug and wax plug. There's a bit of a blistering at the base of the ear canal, so that was the skin that was lining the wax plug was also due to the canal walls. When I removed that, it did cause a bit of blistering, but it was fine. Patient wasn't experiencing any discomfort. There's some mushy, dead skin here. It's on the bony part of the ear canal, so I was very reluctant to use a Jobson horn just to make contact with the bony part. It was a bit uncomfortable. I'm just going to go back in, mop up. I'm not too concerned by that. You can see the eardrum. Now, I'm just going to go back to the acoustic neuroma. So it's very rare, but I think 1 in 1,000. Now, and I think, again, if you do have an acoustic neuroma, I think 1 in 10 can actually grow. And therefore, if you are diagnosed with an acoustic neuroma or vestibular schwannoma, I think you have yearly MRI scans and they measure the size of this soft tissue growth. So it's, you call it tumour if you like, but it's not cancerous. People get scared sometimes that it's cancerous, but it's not. It's non-malignant. It's just a benign growth. And if this soft tissue growth grows, of course, your ear's just below your brain. And in some cases, they have to perform gamma knife surgery. That's when they kind of try to target that soft tissue growth and trying to shrink it. And in that ear, the patient hasn't had to have any gamma knife surgery to shrink their acoustic neuroma because it's not growing, but it has left them with very little hearing in that ear. And I think she mentioned it's 2% hearing. Very likely it's a profound hearing loss where a hearing aid wouldn't help this individual because the hearing's too poorly damaged, the auditory system, the auditory nerve. Well, I hope you enjoyed that video, guys. Take care, keep well, and be nice and be kind to each other. Bye.